So good morning to all of you. Good morning, good morning. Okay, so welcome back to the image based MCQ and image based revision. Okay, again some MCQs and some visuals for you. Am I audible to all of you? Yes, Nitin? Starting with the first MCQ. Here we go. I'm Dr. Pradeep Pawar. Okay, fine. Very good. Chalo, we'll start. Identify this pointed structure. Identify the pointed structure. Good morning to all of you. A cadaveric image, as you all wanted. Yes. Answer. You can guess. Come on. First, identify which part it is. Yes, it is the forearm. Right. Which aspect of the forearm is it? Anterior or posterior, ventral or dorsal? It is the anterior aspect of the forearm. Yes. What is the answer for this? The pointed one, the blue pointed one. This is the flexor carpi radialis. This is the flexor carpi radialis. This would be the palmaris longus. Look, ye hoga palmaris longus. Palmaris longus has got a small belly and a very long tendon. So the next muscle to it would be palmaris longus. Anyway, you know the 5 muscles of the front of the forearm, the superficial muscles. The first one, pronator teres. So that is the pronator teres. Here, this is the pronator teres. Pronator teres has got 2 heads, a superficial head and a deep head. And what passes between the 2 heads of pronator teres? Yes, come on, answer. What passes between the 2 heads of the pronator teres? That's a median nerve. And what passes deep to the deep head of pronator teres? Yes, what passes deep to the deep head of pronator teres? That's the ulnar artery. Okay, in other words, the deep head of pronator teres separates what from what? The median nerve from the ulnar artery. Okay, very good. So that's the pronator teres. This muscle is the flexor carpi radialis. The next one, this is the palmaris longus. The next would be, it's not very clear, but this would be the flexor digitorum superficialis, and the last muscle would be the flexor carpi ulnaris. Okay, so this is the flexor carpi radialis. Any idea what is the action of this flexor carpi radialis? Yes, anyone? What would the action of flexor carpi radialis be? Yes. Action of flexor carpi radialis. एक तो flexion है. One is the flexion at the elbow joint, right? Because it is arising from the medial epicondyle of the humerus. Second would be the flexion at the wrist joint. Flexor, because it is crossing on the anterior aspect, it causes flexion at the wrist joint. And second, it's on the lateral side, so it does this. What is this for the wrist? This is abduction at the wrist. So abduction along with a muscle on the extensor aspect. That's extensor carpi radialis longus and brevis. So flexor carpi radialis along with extensor carpi radialis longus and brevis, together they do what? Abduction at the wrist joint. Clear to all of you? So that's it. Now I just want you to understand, there's something on this side, there's something on the lateral side of flexor carpi radialis, and there's something on the medial side of flexor carpi radialis. It's not seen in the slide. I'm just asking you this. What could that be? Something on the lateral aspect of flexor carpi radialis and something on the medial aspect of the flexor carpi radialis. Any guesses? Something on the lateral side, something on the medial side. Radial artery, excellent, Nitin. So radial artery is on the lateral side, right? Radial artery would be on the lateral side of flexor carpi radialis, and who's on the medial side? Means between the flexor carpi radialis and the palmaris longus. Flexor carpi radialis and the palmaris longus. What do you get? There's something here, if you can tell me. Between the flexor carpi radialis and the palmaris longus, what do you get? Bolo? Answer. Between the flexor carpi radialis and the palmaris longus, you get a nerve. That's the median nerve, right? That's the median nerve that we get. And the median nerve now goes deep to the flexor retinaculum. It passes through the carpal tunnel, right? It passes through the carpal tunnel. Okay. Clear to all of you? Just quickly going through the median nerve, a quick go through the median nerve. Answer this. Median nerve is formed by two roots. One is the lateral root of median nerve and the other one is the medial root of median nerve. The lateral root of median nerve is a branch of which cord? The lateral cord. And the medial root of median nerve is a branch of which cord? The medial cord. If you can just tell me what is the root value of lateral root of median nerve? Answer this. Root value of lateral root of median nerve is, it's a branch of lateral cord, so the root value is C5, C6, C7, and the root value of the medial root of median nerve, it's a branch of medial cord, so it's C8, T1, C8 and T1. Okay, a quick go through the median nerve. Have a look, understand this. I'll just make this for you. Right, so that's the axillary artery here. Again, what is this muscle? I'm not changing colors. I'm using the same color now because no, it takes time to change colors. Tell me, what is this cord? What is this cord? And what is this cord? That's a pectoralis minor. That's the second part of the axillary artery. That's a lateral cord. That's a medial cord. That's a posterior cord. So what is this now? That's a lateral root of median nerve. What's this? That's the medial root of median nerve. And what's this now? That's the median nerve. So where is the median nerve formed with respect to the axillary artery? Can you tell me where is the median nerve formed with respect to the axillary artery? On the lateral side. The median nerve is formed on the lateral aspect of the third part of the axillary artery. Are you getting this? Because this root of median nerve is longer. The medial root of median nerve is longer, goes to the lateral side, joins with the lateral root. So the medial root of median nerve is longer, goes to the lateral side, joins with the lateral root. So the median nerve which is formed is lateral to the third part of the axillary artery. Clear? Now this median nerve is going to cross, the brachial artery from the lateral to the medial side. Okay, it crosses the brachial artery from the lateral to the medial side, and thus when you see this cubital fossa like this, who's the most medial structure in the cubital fossa? That's a median nerve, followed by the brachial artery. Median nerve followed by the brachial artery and its two terminal branches, the radial and ulnar artery. Third would be the tendon of biceps and fourth is the radial nerve. You're clear? So how does the median nerve come to the medial side? Median nerve is first on the lateral side. It crosses the brachial artery from the lateral to the medial side, comes at the medial aspect, lies the most medial structure in the cubital fossa. How does the median nerve leave the cubital fossa? By passing between the two heads of the Pronator Teres. Here it passes between the two heads of the Pronator Teres, the median nerve. The median nerve is separated from the ulnar artery by the deep head of Pronator Teres. Clear? Yes, lateral root gives C7, yes, fibers to the ulnar nerve. That's right, that's the lateral cord above, lateral root me, the lateral cord, yes. Okay, and now how does the median nerve come to the forearm now? Now the median nerve enters the forearm by passing between the two heads of Pronator Teres. Now tell me, in the forearm, the median nerve lies on which muscle? This I've told you yesterday. In the forearm, the median nerve lies on which muscle? Come on, answer. In the forearm, the median nerve lies on. Come on, my dear children, answer. In the forearm, I have to search the median nerve. Yesterday I told you this. Where do I search the median nerve? I just lift a muscle and the median nerve is right below the muscle. Who's that muscle in the forearm? Yes, the flexor digitorum superficialis. I just lift the flexor digitorum superficialis and what do I see? The median nerve. And the median nerve is lying on which muscle? Flexor digitorum profundus. Flexor digitorum profundus, clear? So in the forearm, the median nerve lies between the flexor digitorum superficialis and the flexor digitorum profundus. Now the median nerve has come at the wrist. Up clear hai? Now the median nerve has come at the wrist. Suppose if I have to search the median nerve at the wrist, where do I search? I have to search the median nerve at the wrist. I'll just show you the slide. If I have to search the median nerve at the wrist, I just search for this tendon first. This tendon, a very prominent tendon that you can always see, that's the Palmaris Longus. And just go lateral to the Palmaris Longus, just lateral to the Palmaris Longus, and there has to be the median nerve. There has to be median nerve. And further lateral to the median nerve would be what? The flexor carpi radialis. Yeah, this is what I was telling you. Look. This is the flexor carpi radialis and this is the Palmaris longus. And who's that? That's a median nerve. That's a median. Don't see this muscle. Ye thoda deep muscle. Don't see that. So that's the median nerve. At the wrist, the median nerve lies between the flexor carpi radialis and the Palmaris longus. I'm telling you the entire course of median nerve. Just understand this. Now the median nerve enters the hand deep to the flexor retinaculum. That means it passes through the carpal tunnel. It passes through the carpal tunnel. It lies between what and what? In the carpal tunnel, it lies between the flexor retinaculum and the ulnar bursa. Ulnar bursa. It lies between the flexor retinaculum and the ulnar bursa. And when there's an inflammation of the ulnar bursa, the median nerve gets compressed here, and that is what we call as the carpal tunnel syndrome. Now, in the hand, now the median nerve is in the hand. In the hand, the median nerve supplies 5 muscles. The 3 muscles of thenar eminence. What is that? The first one, abductor pollicis brevis. Second, flexor pollicis brevis. And third, opponens pollicis. Opponens pollicis. And the first and the second lumbricals. First and the second lumbricals. Okay. So that's a complete median nerve for you. And sensory supply kitna hota hai? Sensory, how much sensory does it supply? This 3.5 fingers on the palmar aspect and 3.5 fingers except the proximal phalanges on the dorsal aspect. That's a cutaneous nerve supply, right? 3.5 fingers on the palmar aspect and 3.5 fingers except the proximal phalanges on the dorsal aspect. Is this clear to all of you? Understood the median nerve? And who supplies the skin over the thenar eminence? Over the thenar eminence is supplied by the palmar cutaneous branch of median nerve. The palmar cutaneous branch of median nerve is a branch given by the median nerve before it crosses the flexor retinaculum. Before it crosses the flexor retinaculum, it gives this branch which supplies the skin here. And that is why when there's a carpal tunnel syndrome, this 5 muscles will be paralyzed. There will be a sensory loss of this 3.5 fingers on the palmar aspect and 3.5 fingers except the proximal phalanges on the dorsal aspect. But the sensations of the skin over the thenar eminence would be intact. And this is how we know that the nerve is compressed in carpal tunnel. Is this clear to all of you? Koi doubts? Any doubts? Yes. Okay, fine. Clear? Right. We'll go to the next MCQ. So I've told you the complete median nerve, huh? Chalo, answer this now. Fine. Right. Answer this. Okay. The others also answer. Yes, even if it is wrong, it's okay. Do not retract your message. You're not giving an exam. Okay, this is just a discussion. And be interactive so it is easy for me to explain also. Answer is B. Okay, D. Fine. Just understand one thing. Look, ये clear है ना? A 50 years old male complains of pain in the pectoral region. On examination, a soft tissue swelling of pectoralis minor was noted. On MRI scan, it was further revealed that there's a compression of the axillary artery. Soft tissue swelling of pectoralis minor. So compression of which part of the axillary artery is it? Yes, compression of which part of the axillary artery? Second part of axillary artery. Alternate blood flow is maintained by anastomosis between. This is extremely important. Just have a look and understand this. Okay, now look, I'll make this for you. Ye kaun hai? You tell me. That's the first strip. Okay, first strip. What is this artery here? What's this artery? That's a subclavian artery. And what is this artery? That's the axillary artery. What is this muscle here which divides the axillary artery into three parts? That's the first part, that's the second part, and that's the third part. That's the pectoralis minor. And what is this muscle which is going to divide the subclavian artery into three parts? That's the first part, behind the muscle is the second part, and that's the third part. Ye kaun hai? This is the scalenus anterior, and this is the pectoralis minor. Fine. So understand this. Axillary artery is divided into three parts by the pectoralis minor. The subclavian artery is divided into three parts by the scalenus anterior. Why is this so important? Look, if there's an obstruction to the second part of the subclavian or to the third part of the subclavian artery, or if there's an obstruction to the first and the second part of the axillary artery, there will be an alternate blood flow from the first part of the subclavian to the third part of the axillary artery. There's an anastomosis always between the first part of the subclavian and the third part of the axillary artery. Okay, anastomosis on the dorsal aspect of the scapula. Okay, I'll just write this for you. So anastomosis on the dorsal aspect of the scapula is between the subclavian and the axillary. Which part of the subclavian? First part. And which part of the axillary artery? Third part. If you can tell me which branch from the third part of axillary artery, come on. Which branch from the third part of the axillary artery is it? Yes, come on, my dear children. Which branch from the third part of the axillary artery? It is the subscapular, or to be specific, it's a branch of subscapular. Any idea? It's a branch of subscapular artery. Circumflex scapular artery. Circumflex scapular. So which part of the axillary artery? Third part. And which branch from the third part? Subscapular. A branch of subscapular. That's circumflex scapular. This should be perfect. Axillary is clear? Just tell me. Is the axillary artery clear? So anastomosis is between the third part of the axillary artery. Which branch? Subscapular. Uska branch, circumflex scapular. And if you can just tell me, how does this circumflex scapular come to the dorsal aspect of the scapula? This is on the costal surface. How does the circumflex scapular artery come to the dorsal aspect? It passes through a small space there. Name of the space. It passes through a small space. Any idea? No, quadrangular, no, bache. It's not quadrangular. No. It's not quadrangular, my child. Any other space that you know of through which the circumflex scapular artery passes? Okay, spaces of the around the arm, that I'll tell you later. Just tell me. Any guesses? Anyone? Come on. Which space is that? It's the upper triangular space. Upper triangular. So what passes to the upper triangular space is the circumflex scapular artery. And this circumflex scapular artery comes to the dorsal aspect. Is this clear to all of you? That's the circumflex scapular artery. Okay. Understand? I'll tell you something else here. Now, we just discussed the subclavian artery. Understand this. Subclavian artery is divided into three parts by whom? The scalenus anterior. And what are the branches from the three parts? Okay, look, this is vitamin C, D. That's the first part, that's the second part, and that's the third part. First part, second part, third part. If you can just tell me, what is V for? V is vertebral. I. Come on, answer this. V is vertebral. I. Anyone? I. I क्या होगा? I is an artery which runs on either sides of the sternum inside the thorax. Come on either sides of the sternum, right? That's the internal thoracic artery. Internal thoracic artery, also known as internal mammary artery. And T is the thyrocervical trunk. Thyrocervical trunk. But remember, it has the thyroscapulocervical. Look, the books will mention this as thyrocervical trunk, fine. But remember what I always tell the students, thyroscapulocervical. So 3 branches hai, 3 branches becomes very clear. 3 branches of thyroscapulocervical trunk. One is to the thyroid. Any guesses? Inferior thyroid artery. Inferior thyroid. The second one is the suprascapular. And the third one is the superficial cervical. Just understand this. There's something very important which I'll tell you once. Let me finish these branches. So thyrocervical trunk ke 3 branches. Inferior thyroid. Quickly tell me, this inferior thyroid is going to anastomose with. Come on, answer this. This inferior thyroid artery is going to anastomose with the superior thyroid artery, which is a branch of external carotid. It's a branch of external carotid. The suprascapular artery comes to take part in anastomosis on the dorsal aspect of the scapula. Okay, suprascapular will come to take part in anastomosis. And the third one is superficial cervical. It goes in the neck. Cervix is the neck. Superficial cervical. Very good. C. What is C? C is the costocervical trunk. Costocervical trunk. ये costocervical trunk के 2 branches. One is the superior intercostal artery, and the second one is the deep cervical artery. Superior intercostal artery and the deep cervical artery. And what is the branch from the third part? What's D? D is dorsal scapular. Okay, these are the normal branches of subclavian artery that we always talk of. These are the normal branches. Now understand something that I'm telling you is difficult now. Okay, so VIT, V from the first part, C from the second, D from the third, vertebral, internal thoracic, thyrocervical trunk, uske branches, inferior thyroid, suprascapular and superficial cervical. The costocervical trunk gives 2 branches. One is the superior intercostal artery and the deep cervical, and the third part is dorsal scapular. Is this clear to all of you, my dear children? These are normal branches, normal. Now see, sometimes what happens, sometimes instead of superficial cervical and dorsal scapular comes from which part? Third part. Dorsal scapular comes normally from the third part, and superficial cervical comes from first part. Instead of these 2 arteries coming as 2 separate branches, these are 2 separate branches. There's a single artery which comes from the first part of the subclavian artery, and this is what we call as the transverse cervical artery. Transverse cervical. Tell me, transverse cervical artery arises instead of which 2 arteries? The superficial cervical and dorsal scapular. Dorsal scapular is from the third part. Remember, if it arises as transverse cervical, then there will be no branch from the third part, because transverse cervical comes from the first part. समझ में आ रही है? थोड़ा सा it is slightly difficult. I just try to understand this. Now this transverse cervical divides into 2 branches. One is the superficial ascending branch, and the second one is the deep descending branch. Superficial ascending and the deep descending branch. Superficial ascending and the deep descending branch. Now you tell me, this superficial ascending branch of transverse cervical would correspond to which artery? Say there are 2 persons, person A and person B. Suppose, understand this like this. There are 2 subjects, subject A and subject B. Subject A mein, these are the branches, with the normal branches that we have talked of. That is in person A. Fine. What happens with person B? In this person B, instead of this superficial cervical, and dorsal scapular. In this person B, there's a single artery which comes from first part of the subclavian. And what is that artery? Transverse cervical artery. Now this transverse cervical, to maintain the similarity, A mein there are two branches. In subject B there's only one branch, transverse cervical. In A there is superficial cervical and dorsal scapular, right? Instead of these two arteries, there's a single artery which comes in B, that's transverse cervical. So how do you maintain the similarity? This transverse cervical divides into a superficial ascending branch and deep descending branch. Tell me, this superficial ascending branch in B would correspond to which artery in A? Understood, very good. That's superficial cervical, and the deep descending branch in this person B would correspond to which artery in A? Come on, answer this. Deep descending branch in B, person B, would correspond otherwise to which branch in A? Yes, dorsal scapular. But what is the difference? Tell me, what is the difference in this deep descending branch and dorsal scapular? What is the difference? What is the only thing if I compare the dorsal scapular and the deep descending branch? Polo, in subject B, deep descending branch, in subject A, dorsal scapular. What is the difference there? If you can understand this. नहीं वैसे नहीं. हाँ, yes, I want that. Deep descending branch in person B is arising from first part, whereas dorsal scapular in person A is arising from third part. समझ में आ रहा है? Are you following this? It is slightly difficult. So now you tell me, anastomosis on the dorsal aspect of the scapula is between the first part of the subclavian artery. ठीक है, first part of the subclavian artery. So which artery is always there? Which is the artery always there? Suprascapular artery is always there. Suprascapular artery is always there. And which other branch would be there? Sorry, this is gone. Suprascapular artery is always there, and the second would be the deep descending branch of transverse cervical. Suprascapular artery is always there. Suprascapular तो है ही in both the subjects. In both the subjects A and B, suprascapular will be there. But if it is the subject B, there will be an additional branch. That's a deep branch of transverse cervical. Dorsal scapular is not going to take part in anastomosis. Remember, because dorsal scapular arises from third part. Wait, I'll make it simple for you. अगर confusing है, you tell me, my dear children. See, it is my job. One moment, I'll just come back and I'll go back. Look, understand it. I'll make it simple for you. Look, instead of superficial cervical and dorsal scapular. This comes from the first part and this comes from the third part. There's a single branch which comes. What is that? Transverse cervical artery. Now, to maintain the similarity, it divides into a superficial ascending branch and a deep descending branch. ठीक है? So, superficial ascending branch would otherwise correspond to superficial cervical, and deep descending would otherwise correspond to dorsal scapular. Now, anastomosis is between the first part of the subclavian and axillary. Now, which part of the subclavian? First part, and which part of the axillary? Third part. Tell me now, which branch from the first part? First part mein suprascapular is there, and which is the other branch? Which is the other branch from the first part? Understood? Which is the other branch from the first part? Dorsal scapular nahi aayega. Which is the other branch from the third? Yes, that would be the deep branch of transverse cervical. Deep branch of transverse cervical. Are you clear? Deep branch of transverse cervical would be there only if transverse cervical artery is there. Understand? Deep branch of transverse cervical otherwise corresponds to which artery? The dorsal scapular. But dorsal scapular will not take part in anastomosis because dorsal scapular arises from third part. Perfect. Yes, perfect to all of you. And third part of axillary artery clear enough, which is a branch? Subscapular or circumflex scapular. Subscapular or circumflex scapular. Okay. Any doubts anyone has, you can ask me. Any doubts anyone has? Clear? Perfect. Clear. Which image, my child? Image. Okay. One moment. Look. That's a slide. Don't consider this. This would be the deep branch of transverse cervical. Deep branch of transverse cervical. And what would this artery be? This would be the suprascapular artery. Suprascapular artery and the deep branch of transverse cervical. And what is this branch? Circumflex scapular artery. Circumflex scapular. Just remember, go through it once again. You'll be understanding it. Okay, will I tell you the spaces around the arm? Yes, tell me. Should we discuss the spaces around the arm? So that is also a very, very important topic. Spaces around the arm. Now that we have come to this topic, so let us discuss the spaces around the arm. What do you say, all of you? Yes, spaces around the arm. Just have a look. Another very important. Get your concepts clear. I'll start with this one. Spaces around the arm. Look, that's the scapula. That's which aspect of the scapula is this? Quickly tell me. What is this aspect of the scapula? That's the humerus. Which aspect of the scapula is this? Tell me fast. ये spine है, ये acromion process है. That's the humerus. What is this aspect of the scapula? Dorsal aspect. That's the dorsal aspect. Identify this muscle. Identify this muscle which begins from the infraglenoid tubercle. Yes, any guesses? The muscle which begins from the infraglenoid tubercle. Identify this muscle which begins from the infraglenoid tubercle. That's a long head of triceps. Very good. That's a long head of triceps. And identify this muscle which begins from the dorsal aspect of the scapula on the lateral border. Quick. Dorsal aspect of the scapula on the lateral border. What is this? This is teres minor and this is teres major. Where is the teres minor inserted on? The greater tubercle. Teres minor is on the greater tubercle. Teres major goes and gets inserted on. It is going in front. देखो ये आगे जाता है. It's going in front and it gets inserted on the medial lip of the bicipital groove. It goes and gets inserted on the medial lip of the bicipital groove. So now you've got three spaces here. Look, this is so nice. This is one space here. This is the second space here. And that's the third space here. That's it. So what is this space? This is what we call as the lower triangular space. Lower triangular space. This is what we call as the upper triangular space. And this is what we call as the quadrangular space. Quadrangular space. What passes to the upper triangular space? I've just told you this. Look, who's this who's come here? Through the upper triangular space passes an artery. That's the circumflex scapular artery. Circumflex scapular artery. What are the boundaries of the upper triangular space? Teres minor above, teres major below, and the long head of triceps. Teres minor, teres major, and the long head of triceps. What are the boundaries of lower triangular space? That's the teres major. That's the long head of biceps, and this is the shaft of the humerus. Shaft of the humerus. There's an artery here, and there's a nerve here. What is the artery and what is the nerve? That's the radial nerve. That's the radial nerve, and the artery is profunda brachii artery. The radial nerve and the profunda brachii artery. And what passes to the quadrangular space is the axillary nerve and the posterior circumflex humeral artery. Axillary nerve and the posterior circumflex humeral artery. What are the boundaries of quadrangular space? Teres minor, teres major, the long head of triceps, and the neck of the humerus, Okay, that's how you remember it. This is the long head of triceps. By mistake, somewhere I said biceps, long head of triceps again. Okay, this is the teres major, and that's the teres minor. So that's how the muscles are. Is this clear to all of you? Now quickly tell me, what are the muscles arising from this side? Muscles arising from here. Tell me, what is this muscle? From the superior angle to the spine. Contents वगैरह सबको clear है ना? All are clear with the contents and all. Yes, what is this muscle? Arising from the superior angle to the spine of the scapula. That's a levator scapulae. What is this muscle opposite to the spine? Any guesses? Opposite to the spine, here and below the spine. Opposite to the spine? Yeah, this one. Opposite to the spine, what's that? Dorsal aspect of the scapula, medial border. This is the rhomboides minor. Yes, that's rhomboides minor. And what is this? This is the rhomboides major. Right. What is this muscle above the spine? Above the spine here, this is what? Supraspinatus. And what is this muscle? Infraspinatus. Supraspinatus and infraspinatus. What is this muscle which arises from this supraglenoid tubercle? The muscle which arises from the supraglenoid tubercle is the long head of biceps. And quickly, if you can just tell me, what is the muscle which arises from the lower border of the spine and the lateral border of the acromion? Lower border of the spine and the lateral border of the acromion. And if I draw something here like this, yes, if I draw something here like this, the same muscle would arise from the anterior part of the clavicle. Yes, answer this. What is this muscle? Any guesses? So the lower lip of the spine, the lateral part of the acromion, and the anterior, the lateral 1/3 of the clavicle, this is the deltoid. Very nice. And this entire deltoid goes and gets inserted on the deltoid tuberosity of the humerus. Okay, it goes and gets inserted on the deltoid tuberosity of the humerus. And what is this muscle attached here inside here like this? Upper border of the spine, the medial border of the acromion, and the posterior border of the clavicle. Any idea what is this muscle? On the inner aspect. Trapezius. Very good. That's a trapezius muscle. Trapezius. Right. Very clear to all of you. I'll just brief you before I go to something else. Okay. I'll just brief you about our platform. Is this clear? I'll clear this slide. Sternocleidomastoid इधर होता है. Medial aspect. Fine, so that's the entire clavicle in a nutshell that I've told you. Okay, so I'll just brief you about our platform that we have. Look, we have got this Plus subscription in which you have daily live classes, the live quizzes, the structured courses, and the unlimited access to the course material. The iconic subscription where you have got the best of the Unacademy, the lectures, and the pre-planned notes. The prices are further slashed, a limited time offer. Have a look at the website. We've started with a 4-year subscription now. And raise a hand. This is a new technique introduced in the app. If you press the icon, you can directly talk with the educator. We're starting with integrated clinical batch and a dual educator batch from 30th of June. Okay, dual educator wherein 2 educators will be discussing on one particular topic, and integrated clinical is a different thing. NEET PG, a high yield revision batch starting from 30th of June. We're also starting with NEET PG seasons batch from 30th of June. 2 new batches target next 2022 and focus FMG on 30th of June. Okay, 3 months subscription you get 1 month free, and on 12 months subscription you get 2 months free, and download the Unacademy app. Okay, fine. So now I wanted to discuss this. Chalo, once last MCQ. Answer this. No, class is not over. Answer this. One last MCQ. And put some MCQs also, but then theek hai. We'll again discuss it sometime later. Answer this MCQ. A 35 years old female comes to the OPD. Her newborn child complains of vomiting after feeding. Obstruction to the small intestine was thought of. MRI scan revealed a mass around the second part of the duodenum and narrowing of the lumen. A diagnosis of the annular pancreas was made. All the following are derived from dorsal pancreatic bud except, yes, uncinate process. Very good. That's the uncinate process. Uncinate process is derived from the ventral pancreatic bud. Just have a look at this slide. So tell me now, this is the midgut, this is the foregut, and this is the midgut. So the entire GIT is derived from what? The entire GIT is derived from the yolk sac. The entire GIT is therefore what in origin? Endodermal in origin, endodermal. And the small pouches that we get from the GIT, a small diverticulum for the liver and the gallbladder, a small diverticulum for the pancreas. All this diverticula which are derived from the GIT are what in origin? Endodermal in origin. Now this is a diverticulum for the liver, the hepatic diverticulum, which is derived at the junction of foregut and the midgut. That's diverticulum is known as hepatic diverticulum. At the junction of hepatic diverticulum and the gut, you get a bud here. What's this? This is the ventral pancreatic bud. Ventral pancreatic bud. Exactly at the opposite side, you get another bud here. What's that? The dorsal pancreatic bud. Now this ventral bud will go from back side, will migrate from behind, come and join with this dorsal pancreatic bud. Okay, so the ventral pancreatic bud goes from behind, comes and joins with this dorsal bud. What is a dorsal pancreatic bud form? It forms the upper part of the head, the neck, the body, and the tail of the pancreas. Upper part of the head, neck, body, and tail of the pancreas. What is the ventral pancreatic bud form? It forms the lower part of the head and the uncinate process. The lower part of the head and the uncinate process, right? Now tell me, what is this duct of? What is this duct of? This is the duct of the dorsal bud. And what is this duct of? This is the duct of the ventral bud. Ventral bud. See, normally who rotates the ventral pancreatic bud migrates from behind and joins with the dorsal bud. But sometimes the ventral bud partly goes from behind and partly comes from front. Such a type of pancreas which is going to encircle the duodenum is therefore known as what? Annular pancreas. So annular pancreas occurs due to defective migration of the ventral pancreatic bud. Remember, anyway only one bud migrates. Who's that? The ventral pancreatic bud. And improper migration of the ventral pancreatic bud results in annular pancreas. If this ventral bud does not fuse with the dorsal bud, we get a divided pancreas, and what do we call this as? A pancreatic divisum. Pancreatic divisum. So non-fusion of the two pancreatic ducts results in a pancreatic divisum. Pancreatic divisum. Clear? Now this is the duct of the dorsal bud and that's the duct of the ventral bud. How's the main pancreatic duct formed? The main pancreatic duct is derived from the duct of the dorsal bud, the duct of the ventral bud, and the anastomosis between them. This is the main pancreatic duct. And what is this now? What is this which is left here? This is the accessory pancreatic duct. Accessory. So the main pancreatic duct is also known as the duct of, yes, duct of Wirsung. Duct of Wirsung. And this duct of Wirsung is formed by the duct of the dorsal bud, the duct of the ventral bud, and the anastomosis. And this main pancreatic duct opens in the second part of the duodenum. Yes, 8 to 10 centimeters from the pylorus. 8 to 10 centimeters from the pylorus. And the accessory pancreatic duct is known as the duct of Santorini. Santorini opens at the minor duodenal papillae 6 to 8 centimeters from the pylorus. That's the duct of Santorini. The accessory pancreatic duct or the duct of Santorini formed by the duct of the dorsal bud opens at the minor duodenal papillae. How many centimeters from the pylorus? 6 to 8 centimeters from the pylorus. Clear to all of you? So I included one embryo MCQ today. Okay, thank you. Thank you. I hope things are clear to you. Yes? Any doubts? Sam, any doubts? Yes, Pradeep, clear? Clear to all of you? Nitin, Ayush, Adab? Okay, so thank you. I hope everything is clear. Thank you for this wonderful session. Thank you.